Hi. And whenever you're ready.
Hi, I'm Carl Turner reporting for Pixels and Pills from the Pharma Summit, and I have Amy Cowan here with me from Google. Amy presented yesterday at the eMarketing University and had a very great session with a lot of activity, so I wanted to ask her about how she felt her session went. Amy, how did you feel your session went?
Thanks for having me here. It went great. We got a lot of good questions around our new search formats. There was a lot of tweets I actually checked afterwards, some surprises from the audience in regards to YouTube's audience matching that of the general population, with 20% being 55 plus. And just, I think some general positive feedback in terms of, people better understanding what the digital trends are. I covered 5, the emergence of the e-patient, and that for search, we're seeing queries up, 200% from 2006 for health conditions. For video, obviously content is exploding across the web, and video for health really is something that patients really want to see more of. They want to hear from medical experts, and they really want to use that information to have more meaningful dialogue with their physicians. On the mobile front, I talked a little bit about just how smartphones are really changing the way that people are interacting with information, and that people are looking for information about their health in real time, and that will impact how marketers connect with them, as well as how consumers consume that information. And then I touched on the role of physicians with the digital channel, and that the acceptance of digital by physicians has increased dramatically. We found through our research that 21% of physicians are actually using the internet in the exam room to look for information, which is something that has obviously changed dramatically. And so I think, in all, there's a lot of insights for marketers to take away and to actually take action in 2010 to think about how they can use those strategies to reach consumers and physicians at the moment of relevance.
Okay, I know you presented some of that same information at the FDA Advisory Board meeting. In general, at the FDA Advisory Board meeting on social media and the internet, how did you feel your presentation was received there, and what are your recommendations for the Advisory Board going forward?
Good question. Regarding the FDA public hearing, we did present there, and we focused on search and focused on, the importance for search messages to be as relevant and transparent to consumers as possible. So we presented 2 proposed formats, one for a product claim advertisement so that companies can include both the brand and the condition, and the other for black box drugs. And we're happy that, since the hearing, we actually now have 6 or 7 black box drugs that are live. I just looked, and Enbrel went live yesterday. So I think that we're seeing the industry starting to say, how can we adopt some new formats, and it's a continued dialogue with industry and the FDA. Obviously, we hope to make some progress over the year so that we can get more advertisers live with the formats.
Okay, and I know the submission date for materials is coming to a close. Are there any other things that you plan on submitting?
Yeah, great question. We are working on our written comments right now. I think within the written submission, we're hoping to touch on more on YouTube and display, and just helping the FDA better understand what the controls are for pharmaceutical companies. One of the topics that I talked about yesterday is just the importance of the role of social, and that communities do matter. And we've seen a lot of adoption by pharmaceutical companies using what we call brand channels as a format to have their videos in a place where consumers can find them to learn about patient testimonials, etc. And so we hope to shed a little bit more insight so that the FDA better understands that.
Okay, great. And in regards to the conference, there have been a lot of interesting speakers so far today and yesterday as well. Is there anyone that you particularly enjoyed or are looking forward to hearing from?
Well, that's a leading question, but there's great content today. I think I really liked one of the speakers on the last panel from Sanofi Aventis that said, we as marketers should think of ourselves more as chief financial operators, and that really what our job is to be great investment strategists with our budgets and find the best way to get the best ROI for our companies. And I think that is something that we strive at Google to try to help our marketers with, is how to best understand where they're investing and how that will help drive their business.
All right, thanks a lot, Amy. Carl Turner reporting for Pixels and Pills from the ePharma Summit.